Good morning and a warm welcome to KBC News Check, the day being the 5th day of February 2025. Now, cancer has now become a major health concern not only in Kenya but around the world. Yesterday we celebrated World Cancer Day, and that will form the basis of our discussion on this first hour. And on the second hour we'll still be looking into matters child welfare in a number of things that has happened in the last couple of months. One, the government saying that it will not be work as usual when it comes to children's homes, and of course there are some organizations that have been collapsed. That is a little bit later. But looking at cancer, I'm looking at the 5 cancers that have been a thorn in our Kenyan flesh and also in the world's flesh. We talk about breast cancer, we talk about cervical cancer, we talk about also esophageal, and also colorectal and prostate. Those are the 5 main cancers that are really troubling the country and the world as it is. The statistics that we have around 5,226 new cases of cervical cancer only in the country, and 10 million people are dying worldwide because of cancer. These statistics are startling, bearing in mind that we have new medical interventions and also we have new technologies, but unfortunately the disease seems to be killing a lot of people. Without further ado, allow me to introduce my panel of experts. We have 3 ladies and a gentleman. We also even have a cancer survivor who will be telling us how the journey has been. Also a caregiver will tell us how things have been being on the other side of taking care of somebody suffering from cancer. And also we have a doctor in the house who has seen it all. Beginning from my immediate left, we have Rose Geshohe, who is a cancer survivor. Many thanks indeed for making time for us, Rose.
Okay. Thank you for having me, Troy.
And just next to him, we have Dr. Joseph Mageto. Dr. Joseph is a medical officer at Texas Cancer Center, one of the key hubs of ensuring that cancer treatment and management in the country. Karibu sana, Daktari.
Thank you so much.
Just next to him, we have a very important lady. I'm saying that because her journey has been cancer-free, yes, but she has been taking care of somebody with cancer. We have Maureen Geshohe, who is a cancer patient caregiver. Karibu sana, Maureen.
Thank you for having me.
You are the sister to Rose.
Yes, I am.
And just next to her, we have Madam Esther Kariuki, who is the program manager at Women for Cancer Early Detection and Treatment.
Thank you for having me here.
And on the bottom of your screen, we have my colleague who is handling the sign language interpretation, Byron Abuli. Brian, apologies for that. Maybe to begin with you, Doc, yesterday we did celebrate World Cancer Day in regards to how the statistics have been and looking at how many people we are losing. Kenya alone, we are losing 9 women daily to cervical cancer alone. And you've been there, you've seen it all. What are the statistics like?
So, thank you so much. What we're looking at is the latest statistics say that about 44,000 new cases of cancer, that was in 2022. We're looking at breast cancer being one of the biggest causes of giving us the biggest challenge. We're looking at cervical cancer in women. In men, we're looking at prostate cancer, and then esophageal and colorectal cancer. These are the top 5 leading causes of cancer in the country, and many people are affected, and many people die due to these cancers. Yeah. And
Rose, I'm looking at people who have been told that they have cancer. That the first thing to kill somebody inside, you know, knowing that you have a condition that has wiped up a lot of people. Tell us your experience as a cancer patient.
When I was first diagnosed, the first thing that happens is become numb. Everything becomes just white or dark because you're processing so many things at the same time. You're processing shock, you're processing denial, you're processing information that you already have, and you're processing a history. You know, for me personally, when I was diagnosed, I have history of how do I say, of having relatives and friends who passed on due to cancer complications. So it's a whole big bag of emotions and it can be ravaging, especially mentally. And one of the things that I was encouraged to do was actually to see a psychiatrist, and a psychiatrist or a psychologist, for me to be able to, to accept the condition as it is, and to start working on treatment plans. Because the moment it has been diagnosed, the best way to healing is through immediate medical attention.
And Rose, if you don't mind me asking, which type of cancer did you have, and at what stage was it diagnosed?
I had invasive breast carcinoma, invasive breast cancer. It was diagnosed at stage 3. Yes, and that is way back in June of 2023.
And Maureen,
Yes.
what was your first reaction when you heard that your sister is having cancer?
It was shocking because she got the diagnosis on my birthday of 2023 in May. That's when she noticed the lump. Yes. And I think during the process of processing the information, she went for now for the checkup now in June. But for me, it was shock when she told me she's discovered a lump. Yeah, it was very shocking.
And how has the journey been from breast cancer to cancer-free? You've been there throughout her journey.
Yes.
Yes.
It's been a roller coaster. It's emotionally draining, first of all. Yeah, you don't even consider the financial aspect, but the draining that it does to you, yourself, to the immediate family. Yeah.
And we'll be looking much deeper into how you guys have been able to do something many people are not able to do. We've had people who have died because of cancer, and the survivors, let's say they are not as many as those people who are dying. Madam Emma, I'm looking at Rose as a cancer survivor. She wouldn't be here with us if she didn't detect it early and it was treated early. Early diagnosis is something that even as a country, we are really trying and struggling to achieve.
Yes, thank you for your question. Early detection is what we need to do to prevent cancer. And the cancers we've mentioned, basically we have some cancers that we detect early. There are others that we are able to prevent. One, like cervical cancer, which is saying it's contributing to 10 deaths daily, where women can go for, we start with HPV vaccination for girls 10 to 14. The recommendation by the World Health Organization is that by their 15th birthday, they should have been vaccinated. And with this, we are able to prevent 90% of cervical cancer cases. It's that important. Then for women aged 25 to 49, they need to go for screening. And the screening methods are available in the facilities. There is a HPV test, which is the gold test, which every woman should have. At least if they got only 2 in their lifetime, it would help to prevent cancer. There is cytology testing, pap smear, which is also available, or visual inspection with acetic acid. Once we do this, the progression of cervical cancer takes about 7 to 15 years to occur. And during this period is where we get changes on the cervix that will tell if you treat these changes, the woman will not have cancer. That's why it has an opportunity. We have an opportunity to prevent cervical cancer. And just to say that cervical cancer is the only cancer that has an elimination agenda. You can eliminate cervical cancer through HPV vaccination, screening of women aged 25 to 49, and then all those that have been identified with issues are treated. They are managed for cervical cancer. And we have cervical cancer treatment when we have those cases. That also happens where we can do surgery or we do radiation. the normal radiation and brachytherapy and chemotherapy. These are available, and that will help to prevent cervical cancer. For breast cancer, we also are able to prevent it from developing to disease by one, a self-breast examination that a woman will do a week after her menses, and a clinical breast examination. You walk into a nurse's room, a clinician's room, not because you're sick, just to have your breast checked. And if the lump is captured early, it is able to be removed, and we prevent breast cancer disease. Then the next prevention is when we get those cases, they go through treatment. We'll be able to have to do that.
All right. Doc, talking about cancer. Yesterday, if you didn't know, is World Cancer Day, and 5 cancers have been identified as the leading causes of death, not only in Kenya, but around the world. And I have 3 ladies and a gentleman who are helping us drive that conversation. Before we went for a break, Dr. had mentioned and asked, from what you have seen at the cancer as the Texas Cancer Center, which are the most prevalent cancer cases that you are having, and how are you managing them?
Yes, thank you. One of the most common cancers is breast cancer. The numbers are huge. It affects many women. The treatment itself is also very expensive, and it requires a lot in terms of investment, a lot in terms of caregiving, a lot in terms of treatment itself. Second, we see a lot of cervical cancer. Cervical cancer, prostate cancer in men, okay? Esophageal cancer, that's one of the leading type of cancers we see. And finally, the colorectal cancers. So those are the 5 most common types of cancers we see. And in terms of treatment, we do give chemotherapy for most of the cancers. There's also the option of going for surgery if the cancer is resectable, or surgery is like the #1 option. Finally, there is an option of radiation therapy and brachytherapy. So these are some of the treatments we offer for patients who are coming with these cancers. Yes.
Rose, back to you. Walk us through your treatment process, and when were you told, after how long were you told that you're now breast cancer free?
Well, I'm going to start from the end of your question. I'm yet to get that judgment that I'm cancer free. But however, the moment it was diagnosed, after the mammogram, the biopsy, the PET scan and the CT scans, I was asked to start treatment immediately. Right? There was no time break. There was no break whatsoever. Because one of the things that had happened to me was I got metastasis. That is, it had spread to my lymph nodes and to my brain. So we started with a radiotherapy treatment on my head to get rid of the brain tumors. Then we started, I went for 10 cycles of radiotherapy, then on to chemotherapy, just as fast as possible. Right now, the doctors told me that they're really not doing radical mastectomy like used to be back in the day. I mean, resecting or getting rid of the breast. So there is something called lumpectomy that is widely used right now. So to save, they resect the lump, but they save your breast. So it's been, that was I immediately after all the tests and confirming how far and getting to the staging, I started treatment immediately. Then again, this was in 2023. Then I stayed for a whole year, then it came back. It came back now bigger, right? So to say, the mets had gone to the metastasis, it had spread. So now I started again on radio, and chemotherapy. So now I'm hoping that once I am done with the chemotherapy that I'm going through right now, that I'll be rendered cancer-free. And from your mouth into God's ears,
Yes.
yes, that they're going to say that I'm cancer-free.
Indeed, indeed.
Yes.
Maureen, you have been in the journey your sister is taking, despite the fact that you are cancer-free. You've walked with her ever since she was diagnosed with the disease.
Yes.
Take us through a typical day of a cancer patient caregiver.
Well, okay. In a day, well, what happens? Let me give an example of what happens when you're going for a hospital visit, for example. We usually wake up very early. We should be up around 5. Because our appointments are usually scheduled very early because we have to go all the way to Kenyatta University, KU. So we get up at 5. So you have to prepare her because her arm was rendered useless. It can't be used because of the lymphedema. So you have to...
So your arm, just a minute, your arm
Yes.
is still because of the cancer?
Yes, when the lymphedema happened, that is the swelling, because I got metastasis, the cancer spread to my lymph nodes, and the tumors were really big, so they pressed on my nerves and my muscle, and the arm, there was a lot of muscle atrophy because I couldn't use it. It was very heavy. So now, until now, I'm going through physiotherapy and other therapies, but for now I cannot use it. I've not used it for over 6 months now. Yes, for over 6 months.
Okay, kindly continue.
Yeah, so this, it takes a toll on you because you have to do everything for her. Yeah, and then the hospital visits there, because my example, it hurts when you see someone you care about in pain. Yeah, so once we do the hospital visits, you have to ensure that she eats the healthy food. You have to ensure she's comfortable. Yeah, ensure that she takes her medication. Yeah, you have to follow up with the doctors because now you're stepping in for her. She can't do these things by herself. So typically that's basically what entails caregiving, more or less. Yeah.
You have given up a lot of some works outside, and even you've given up a lot of your time as well.
Yes, I was going to get to that, yes. Because I had a business. I had to close it down sometime last year in October, because I have to make this a full-time occupation of taking care of her. Yes. Yeah, so a lot of things had to be put on hold, which they still are, until she gets better. Yeah, so that's the typical, that's one of the few things that I've had to put on hold. Yes.
Emma, what we're hearing is quite phenomenal. And looking at early cancer detection, the reason I'm asking this question again is because in Kenya we have a policy, more or less like a policy of staccato testing, where you hear the county government of Mombasa today is having cancer screening, then you hear an organization. We have this staccato, they just come from nowhere, but we do not have a formula of actually ensuring that I can walk into any health center or any hospital and I get tested for cancer. These are some of the things that are clawing back the gains that we've made.
Okay, thank you for your question. Let me say that, yes, earlier on, there was a lot of opportunistic screening. There is this medical camp, there is this organization, but now that situation has changed. One, we have guidelines that spell out screening, and you walk into any facility, you'll get cervical cancer screening. You get to any facility, you will get breast cancer, clinical breast cancer examination, and then we have mammograms for breast cancer screening in the level 5 hospitals in this country. So access is gradually improving. There is a lot that has been done by the government to improve access to screening. And one of the greatest challenges we have is around financing for cancer diagnosis. Because when you do cervical, let's say, take for example cervical cancer, you've come and screened, you identify at the primary level that this client, because she's still a client, she has a lesion. You need to confirm diagnosis, which you are taking to the lab. And that was not being catered for even by the National Hospital Insurance Fund, NHIF. It was not catering for that. And therefore, the patient will have to get that done. And not every other facility will be getting that biopsy. And when they get that biopsy, we do not have enough pathologists, histologists to confirm that diagnosis in the facilities. It has to be maybe in a private lab or in the level 5 hospitals. That is a challenge that we have in achieving diagnosis. Then now from there, the treatment, today we have challenges because getting MRI, the imaging that is assisting CT scan, imaging, ultrasound, the patients have to pay. It comes at a cost. So the essence of getting to diagnosis also becomes challenging. And that's why we appeal for people to go for screening early. You don't have to have, you will not have symptoms for you to go for screening. Screening, you go because you know you need to go and be screened. When you're going for treatment, it's because you already have symptoms. We don't want to get to that because the process of confirming diagnosis is so long, is so tedious. There's a challenge of financing. So why can't we come for screening when we are well? And if we get a lesion, I said cervical cancer gives us an opportunity because there is a pre-cancerous lesion. It is not cancer, but there's a lesion. If we do not treat it, it will become cancer. It will develop to cancer. And we have the treatment devices. 5 minutes, the treatment is done, and we prevent cervical cancer. That is a state in this country, and those devices are all over in the country.
I think we need to create more awareness in terms of that, and also us as the media, we also need to also chip in and try to help people and understand that this disease, if early screened, it can be well managed. Rose, I'm looking at the physical, the emotional, and even the financial draining that cancer has on patients, not only here in the country, because we have seen the cost of cancer treatment is on the higher side. How are you able to circumvent all these challenges?
On my case, I took out the National Health Insurance Fund. I had that. Always paid on time. I have a very supportive family. That's the financial part, for part of it. I have a very supportive family, as you can see, it's evident. And I have very good friends. Spiritually, I have a very good church that I attend. They have held me. They have held me throughout. But that said, financially, I have to go back there. I had a daughter as well who went through the cancer treatment, and financially it can be very draining. I think we went upwards of 6.5 million in her treatment.
In her treatment alone? In her
treatment alone. Because when she was diagnosed, we did not have PET machines in Kenya. We did not have a lot of what we have right now. We have made great steps. We have to give up that. We have to appreciate Kenya for that, and our medical field. So PET scans, I had to take her to India, right? So we have made great steps, but financially it's still a very draining disease.
How is she now, if you don't mind me asking?
Fortunately, she succumbed in 2020.
I'm sorry.
Yes, she succumbed. Yes, it was bone cancer. It was osteogenic sarcoma. But however, that's how much, like for how we spent so far on my journey. One thing I have to tell you, insurance companies, you could be with an insurance. I had insurance. I had insurance, but the moment I was diagnosed, when I was going to renew, they won't renew me. They won't renew my cover.
Because they have detected that you have cancer.
Yes, they just won't renew my cover. And I have been your client for over 6 years. Every year I'm paying premiums. So, so when the insurance companies refused to renew my cover, I had to fall back on the National Health Insurance Fund, which is now SHA, that has been holding my hand in this journey. Not fully.
That was my next question. To what extent is the SHA now covering in terms of cancer?
So far, it has held my hand up to 45%, you would say? Yes, about 45%. Yes, but compared with nothing and having to go out of pocket for medication, it's worthwhile. Yes.
And let me pose the next question to Doc, because the cost of cancer treatment in the country is on the higher side, and institutions like Texas Cancer Center are chipping in to even not only fill the gap, but also to try and bring the cost of cancer treatment down.
Yes, that's true.
In your assessment, I know it's not a rough figure, but in your assessment, she has quoted in her daughter's, her child's treatment went to the extent of 6.5 million.
Yes.
So in terms of the costs in the country, how much are we roughly talking about?
Well, the figures are still not we're just using approximation. And for you to just get adequate treatment, you need upwards of 2 million Kenyan shillings. That's just the treatment. I'm talking about now, especially her who has a certain type of breast cancer that requires newer drugs. Yeah? There's a drug called Herceptin and Pertuzumab. These are newer drugs, and they work, but they're really expensive. We're looking at the PET CT scans, which you need to do, the MRIs, which you need to do. We're looking at the caregivers who need to stop working and focus on taking care of this patient. This patient is not going to work because of the diagnosis. She needs to focus on her treatment. So it's a whole, we can't quantify it in terms of figures, but you can see how expensive it is. When you go to the hospital, you're told you need to see the doctor, you need to see a pathologist, you need to see a nutritionist, you need to see a social worker, you need to see a psychologist, and all this chips into either the patient or the hospital or the government. So it's a really, really expensive, treating cancer is really expensive. And that's what we really all need to agree and need to understand that. Yeah.
And now, because we have SHA, and one of the mandate is to ensure that no Kenyan is left behind, and to ensure that everyone is treated. Can you give us a comparison in regards to what NHIF was covering and now what SHA is covering?
Well, when we look at it in our facility, we used to use NHIF and SHA, and NHIF we could use up to about 1 million shillings for cancer treatment for an individual patient, and also if your partner had the NHIF, we could also co-use. But now SHA has limited the use to about 300 to 400,000 for a year. And unfortunately, that's only in a household. So we're getting now the costs coming into the patient needing to go out of pocket to cater for all these other treatments. Yeah.
Allow me to ask Madam Emma in regards to how we can bring down the cost of cancer treatment in the country, in as much as we have medical schemes that still are in their infant stages, like the SHA.
Thank you for your question. One way to bring cancer treatment down is early screening, and early detection. Once we do that, you just said cervical cancer can be eliminated. So if we all go out for screening, we bring our girls for vaccination, then we will not suffer the cost of treatment of cervical cancer, the psychological stress that comes with cervical cancer, the emotional strain that comes with cancer management, the stigma that comes with cancer management. when we go out for screening. We know there are those cancers that we may not be able to get them in time. Somebody gets sick, and when you go for medical checkup, that's when the doctor will be able to pick it. But there are those cancers, and unfortunately they're the most common cancers, because right now we are saying cervical cancer is leading in the cause of death in our country. It's expensive to treat that cancer, yet it is preventable, starting with HPV vaccination for our girls. Screening of women. So if we come out to screen for breast cancer, don't wait for a symptom. Walk into a clinic and have a clinical breast examination. And then our guidelines recommend mammogram for women aged from 40 years and above. Go for a mammogram screening. We'll be able to identify and have treatment. For colorectal cancer is another cancer. When you see changes in your stool as the first piece, you go to the clinic. Screening again, this can be done even at the community level. And that way, we will actually be able to bring cancer cost treatment down.
And you'll be telling us a little bit later on how, being a program manager, how you are helping out. Because we see Texas Cancer Center and other private institutions are also chipping in to try and bury this scourge. But before then, Maureen, I'm looking at, you have had to give up basically your life for 2-3 years now. And one of the issues when it comes to cancer in the country is stigma.
Yes.
There are some people who don't want to be associated with their relatives or their kin, so who have cancer, because of how draining and emotional and financial draining it is. What are some of the lessons that you have picked up as a caregiver for the last couple of years that you have been with your sister?
Well, the first one I have learned is patience. You have to be very patient. You have to understand that this is not something that you can deal with in a day and get rid of it. It's a long process from diagnosis all through the treatments. The second one, dealing with stigma. Okay, personally, this is what I deal with it by not talking about it, although I do recommend we do talk about it. But there's so much stigma associated with cancer because they consider you like an outcast. They call it, it's a curse. Yeah, they don't want to deal with you. Yeah. And then there's also so much ostracization, especially, when cancer treatments are involved, there's a loss of hair. The darkening of the nails, the lack of appetite, the throwing up. Yeah, so there's so much stigma associated with all those things, the symptoms that come with those treatments and all that. Yeah, so that's the most the most important points regarding the stigmatization. Yes.
Maybe picking from what Emma had talked about in regards to how we can bring the cost of cancer down, and also as an institution, I'm sure that you also are putting measures to try and bring this cost down. Which are some of these measures that you're putting in place to help bring the cost of cancer treatment down?
Well, I guess one of the ways in which you can help bring the cost of treatment is having stronger institutions and empowering them. Also having in-house treatment, having all the specialists in the same hospital. This will help the patient, especially now when they are starting treatment and they need to see 1 or 2 or 3 different specialists. When you go to a different facility, they charge you differently. It takes a lot of time. But having all this in-house, you get to save a lot of money. You just got to pay maybe once or twice for consultation fee, and you don't need to be sent to another facility to pay more and to queue for longer times. Also, as she said earlier, I agree with her about early screening. In our facility, we get to have all these options, screening everyone, okay? Going for medical camps, seeing these patients early enough. When you see them early enough, the treatment becomes cheaper as compared to when the cancer has already spread and it's a stage 4. You need to have more money, do more chemotherapy, and that's really expensive. Thirdly, I want to say that having all this in our country currently, we have a lot of specialists, and there is no need of, let's say, going abroad. And most people, when they get the diagnosis of cancer, the first thing they're thinking, let me go abroad so I can start treatment. But we have everything in our country. We have all the specialists we need in our country. So I'd encourage Kenyans, before thinking of going abroad and spending a lot of money, kindly just try Kenya so that you can cheapen it, make the cost cheaper. Yes.
And Rose, what are some of the lifestyle changes that you've had to adapt to in terms of your diet, your exercises, and maybe stress management, because this thing is draining as well?
Yeah, well, I have had to change a lot. First and foremost has been my sleeping patterns. I would pull all-nighters while I was working. So now I have to, at least get 6 to 8 hours of sleep. For exercise, I was actually a very outdoorsy person. I hiked a lot, mountain climbed and all. So exercise has not been an issue. I've had to gain weight. I have to say, I was really, really skinny. Yes, so that is one. I've had to take a beautiful balanced diet. I have to be on balanced diet now. Basically, social drinking, I've had to bring it down. Absolutely get rid of it. And basically, spiritually, I've learned how to meditate more, pray more. I have become more spiritual. And so far it's helping. I've had to quit my job though. A job I really loved as an outdoor expedition director. That has been, actually that was the biggest challenge, the biggest change in my life that I actually reel with, I reel in thinking about it sometimes. But again, health is wealth, right?
Yes.
Once the health is back, I'll go back to my mountains and to my outdoors.
Yeah, and it's a good thing that you've received help and acceptance from your family, and even your sister has sacrificed everything to be with you.
That's true, and I am very grateful. Very, very grateful.
Emma, not all people are experiencing what Rose is experiencing, a supportive family, and of course, she has had to give up everything just to be with her during her illness. What are some of the programs that you have to ensure that our women, because looking at the first two associated with women, that is the breast and cervical cancers?
Thank you again for your question. Yes, Los is lucky to have had a supportive family in our programs as Women for Cancer, where we believe in early detection and screening. We offer the services for screening and support access to screening services and treatment services. For treatment services, like you have heard from Lo's sharing, you cannot complete it without patient navigation, somebody to walk with you. And I really want to thank her sister who has walked with her. Many a times you get families, you get clients where nobody is walking with them. So we walk with them, patient navigation, that is offering psychosocial support, being there to navigate them. Most of the women out there, especially in the remote areas, marginalized communities, where will they access treatment? In Kenyatta National Referral Hospital. When they come see that building, they're like, no, here we are not going to come again. Accommodation, when they come from rural areas. They don't know anybody in Nairobi. This is another challenge that they get. So these are some of the areas that we work in to ensure for the women that we identify and have problems. We actually work with them physically, and you'll get that most of these women also are not on any insurance cover, even the NHIF, which is the NHIF now it is the SHA, and we support in terms of that. And then offering psychosocial support and identifying what are the linkages for support and care that they can get, and even treatment, post-treatment, what care can they get. And maybe just to say, one of the programs that we really need to work on in this country is community patient navigation. Because when they go back to the community, what support do they get?
Doc, picking up from what Emma has talked about, let's talk about health facilities and healthcare, especially in the rural villages. Looking at Nairobi has so many cancer hospitals and private institutions like Texas. And when we go back to Mashinani, we will find that there are cases there where we do not have early screening that we're talking about here. And when this situation, the cancer situation comes in, well, they have to sell land, you see, they have to sell their property to manage that cancer treatment. How do we increase capacity in our rural areas?
I agree with you. We are having a bit of a challenge, especially in the rural areas. A lot of these patients, first of all, we need to, they're not formally working. They're probably farmers. They're probably people who are casual laborers, so they don't have insurance. So the financial aspect about the cancer treatment itself is a challenge. Second thing is we don't have enough personnel, especially in terms of having people in the facilities, in the hospitals.
Talking about oncologists.
Oncologists, we're talking about nurses who are specialized, we're talking about nutritionists, we're talking about psychologists, because when you're looking at all this cancer treatment, it's not just the doctor managing the patient, it's a whole body of people. And this is what we really need to do, invest more into healthcare. We need to have stronger institutions. We're looking at health financing, we're looking at having technology, we're looking at having this human resource, we're looking at having all these health records personnel. So currently, I think we need to invest more into healthcare. We need to use the annual budget should increase so that we can afford everyone and every Kenyan these facilities that we have in Nairobi should also be able to have in Mandera, we should have it in Malindi, we should have them in Kisumu. Yeah.
Maureen, what are some of the tips that you can give to someone who is taking care of a cancer patient?
The first one, I'd like the people, if you're taking care of a cancer patient, please be patient with them. Please try to be understanding and try to put yourself in their shoes, because it's not an easy trip. It's a very emotionally draining trip. That's all I can say. And try to hold their hand. And support them in any way possible. Yes.
Doc, you wanted to add something?
Well, I agree with her. We need to also create more awareness also to the caregivers. We understand that cancer is, it disfigures people and they face a lot of stigma. They need people to hold their hand. It can be the community. It can be the area local authorities, the chiefs. We have community health volunteers, people to support these people as they're going through treatment. Yes.
And Rose, I'm quite sure you are terrified, just like you said. What are some of the tips that you can give somebody who's just been diagnosed with cancer?
First, breathe in. First thing, breathe in, be calm. Then process it. Start processing it. There are the 5 steps. I always say the first one doesn't work. Denial doesn't work. So you start processing it. There's the bargaining part. That is all right. You breathe in, you be calm, you're going to bargain logically. Should I start treatment now? Should I start it later? Logically, we already know what you have now, you know, that kind of thing, until acceptance, and that's going to ease your way into healing and into being comfortable with your treatment. I have to tell you, Troy, I have seen ladies who are in my condition, who have the same kind of cancer with me, really break down, like they cannot get out of the bed after chemotherapy. Because it's in their brain, I mean, it's in their mind that they are really sick. I have my chemotherapy done. I'm out and about, and I walk myself, well, okay, right now, before it wasn't so easy, to the car and to my room. Before it wasn't that easy though. However, it's mental. So I would advise my fellow ladies or anyone going through treatment for cancer, be calm, breathe in, and it's all in the mind. It's going to get better. That's all I say. It gets better. It's hard right now, but it gets much easier. Yes.
Before I take a quick break, but Emma, I'm still stuck with the question of cost of cancer therapy and treatment in the country, and institutions, I say the private institutions who are coming in to help us. Now, just like Doc said, you don't need to go to India, because mostly we've seen patients rush to India to get that kind of treatment. But in as much as we are having those kind of treatments right here in the country, the costs, diagnosis, the treatment, and the management, including diet, is still on the higher side.
Yes. Thank you for your question. Treatment is expensive. What are some of the things that we can do as a country to make this cheaper? One is making the machines available for diagnosis. Right now, we get patients go to hospital A and you are referred to hospital B for like MRI, like CT scan, because it's not available. How many of our government institutions have these machines or services available? That is one way of bringing the cost down. And then the team approach. You will get today, we are talking of cervical cancer screening with cytology. How many cytologists, trained cytologists, are there in this country? Very few. So you get a woman will get the specimen taken in a public facility and referred to a private facility to get that. That also increases cost. So making this, if the government can make these services available in the government facilities, and we have a team approach, that we have the specialists that are needed for treatment and care, then this cost will come down drastically. The escalation of cost is moving a patient moving from point 1 to point B, cost in terms of time. And you go to this facility, the charges are different from this other facility. There is not standardized costing of these services when we get along. Then the availability of drugs. Today, they are buying drugs which they should actually get for treatment. And this is a drug that you're taking every week. You're counting of how many weeks in a year, and you have to buy that. And now with the SHA, also improving the SHA package. Because when you give a cancer patient to draw from 300 from the family unit, and the cost of treatment, we are talking of 1.2 million or 2 million. So 300, then where do they get the 1.5 from? It takes us to go out of pocket, friends and relatives for fundraising. And this actually brings it down. So the revision of also the SHA package, that is something that we are advocating for.
Thank you. And let's take a quick break. I will be right back and wrap this conversation up. Before we look at also matters, the child welfare, and also how we need to be taking care of our kids as a community and as a society as well. A lot has changed over the years, but let's take a quick break. We'll be right back. Welcome back to KBC Channel 1. We are looking at matters cancer. Yesterday, the whole world, including Kenya, we celebrated World Cancer Day. We're just trying to look at some of the steps that we have made. Where are we as a country? And especially losing 10 women due to cervical cancer alone every day in the country, and 10 million people in the world every year. Those are startling numbers. Again, Rose Geshohe, we have Dr. Joseph Mageto, we have Maureen Geshohe, and also we have Emma Kariuki, who is the program manager at Women for Cancer Early Detection and Treatment. Ladies and gentlemen, allow me now to give you a minute each for your final sentiments. Let me begin with you, Doc, because at the end of the day, even we have the best cancer treatment, if we don't prioritize testing, if we don't prioritize diets, if we don't prioritize therapy, including exercises, well, we're not doing much in terms of cancer treatment.
Yeah, I agree with you. We need to first do, as Emma said, early screening is the best way to reduce the cost. It's the best way to treat this cancer in the country. We also need to strengthen our institutions, either with human resource, financially, using better technology. We need this technology in the country. So cancer treatment is something that it's not just seeing the doctor. It involves many aspects, and all these aspects need to come into one. And having all these treatments in our facilities helps the patient in terms of time, cost, and also mentally. Okay, so I think we all need to band together, talk about cancer more in the country. Yeah.
And a question I've seen somewhere in regards to matters hereditary.
Yes.
Is there any form of cancer that is hereditary?
Yeah, we actually, a good number of cancers are hereditary. We're talking about breast cancer, which is hereditary. We're talking about prostate cancer, which can be hereditary. We're talking about colorectal cancers, okay? And if you look at the top 5, 3 out of them are mostly hereditary. So if, let's say, your mother or your sister had breast cancer, you need to start screening early, okay? If you had colon cancer in your family, you also need to start screening early so that you can avoid getting the cancer. You can start treatment early so that you get treated. Yes.
And before I let you go, just clear in regards to some of the myths surrounding cancer, because some people believe that men can't get breast cancer, and actually we can.
Yeah, it's true. It's not the most common cancer, but in men, but it's men can get breast cancer. So also men need to learn how to screen themselves for breast cancer. You need to do a self-exam. You need to go regularly to the hospital to see a doctor. Yes.
Emma, the programs that we and the policies that we as a country take do mean that we can decide which trajectory cancer takes in the country. If, just like you started saying, if we have early testing and detection, diagnosis, and we also have prompt treatment, then we can bring down the levels and the cases of cancer in the country.
Thank you for that. Maybe before I go into that, let me just touch on what he has talked last about breast cancer.
Yeah.
Yes, men can get breast cancer. And the issue with men, they shy away and do not come out when they have problems with their chest, and they come in too late. So we're also appealing to men, please do not stay behind, come out for screening when you realize there are changes in color, the size of your breast, and you have lymph nodes. Come out. Let us be screened. Let's fight the journey together. Yes. Priority cancers. We have cervical cancer, which is taking a toll, and cervical cancer is eliminatable. So what we need to do as a government is have those key priorities, and we prioritize. The interventions are defined by the World Health Organization. 90% of our girls are vaccinated. 70%. This is the irreducible minimum target towards elimination. That as a country, if we achieve this by 2030, then we are going towards elimination. 90% of the girls are vaccinated by their 15th birthday. 70% of the women aged 25 to 49 are screened. And then 90% of those that have been identified with cervical cancer issues are linked to treatment. The other thing for breast cancer, the other reading in terms of incidence, in terms of causing mortality, the second in causing mortality to cervical cancer, a simple clinical breast examination will help downstage this disease. So if women walked into the facilities and then the capacity of the service providers knowing what is it that they are looking for. So this is the element of the population creating awareness, which is what we do. And then the facilities trained staff, like he said earlier, it's not in every other facility that we have the trained personnel. Then in terms of the supportive element, that we have the drugs, we have the imaging, and imaging goes with personnel, availability of that. Then prostate cancer, we say men 40 years and above, please go for screening. Please go for screening. And that way, we will create demand and pushing the government to also give us the right facilities and the right skills, because if there is demand for accommodation, then the government will respond. Yes? And then we're also talking esophageal cancer. Sometimes coming in too late. It is one of the commonest cancers even in the world globally. So when you have a sore in your throat, stop prolonged self-medication. Come to the facility. Then diagnosis, that the government invests in diagnosis. We only have 3 PET scans in this country for the 54 million of us. We can do better as a country.
Indeed, well said. Maureen, you've walked a journey that many really find it difficult, and some are not even ready to walk that journey with their kins or their relatives. I'd like you to give a word of encouragement to people who are taking care of patients who have cancer.
Okay. I'd like to encourage anyone taking care of a cancer patient, don't give up. Please walk with these people, walk them through, keep tabs on their appointments, their medication, be their strength when they can't move, when they can't do anything, just be there for them. Because that's all they need at this particular point in their lives. Yes, and cancer is not a death sentence. It's just a short period. You're going through difficulty, but there's light at the end of the tunnel. Yeah, so just be with these people. Yeah, hold their
Rose,
hands.
you are our cancer champion for today. And thank you so much indeed for even making time despite your condition.
Yes.
Words of encouragement to people who are undergoing through either chemotherapy, radiotherapy, people who are undergoing treatment for cancer.
All right. Before I go to encouragement, I would like to just point out one thing. If you're a parent, I love being a parent. If you're a parent, please check on your child. When they say their thumb is aching, don't ignore it. Because we should really get rid of childhood cancers. It's about time, and HPV for our young girls. And also, we need what do we say? A healthy working force going forward. Other than that, I would like to encourage my other soldiers who are in this fight. It gets better. Follow on your medications. Follow on what your oncologists are saying. Be positive. Take time to smell the roses and to have the sun on your skin, because it gets easier. It gets easier. And have a lot of support around you. Yes, we are in this together. If you would like to reach out. Yes, I love company. I'll hold your hand. Just reach out. Yes, let's walk this journey together.
All right, Doc. Just one more question in regards to how regular should we go for screening, because just as you said, and Emma has mentioned that for any men who are over 40 years.
Yes.
And when I hit 40, I didn't go for even any. 3 years down the line is when I went for prostate cancer screening, which was I think was in August last year.
Yes.
Many people don't even know that they should actually be on the forefront to ensure that they take care of their body. And screening is one way of actually taking care of your body.
Yeah, I agree with you. We need to encourage more people to go for screening. Especially if you're above 40 years. That's when you start seeing the cancer cases rising higher and higher amongst the age group. I suggest we do at least go screening once a year. Go see the doctor once a year, get a full body check, get your labs done, that will help, especially in detecting the early cancers. Yes.
Thank you so much. I've been hosting a gentleman and 3 ladies. Just beginning from my immediate left, we have Rose Geshuhi, who is a cancer survivor. Just next to her, we have Dr. Joseph Mageto from the Texas Cancer Center. He's a medical officer there. Just next to him, we have Maureen Geshuhi, who has been a cancer patient caregiver to Rose here. And just next to her, we have Emma Kariuki, who is a program manager, Women for Cancer Early Detection and Treatment. Many thanks indeed, ladies and gentlemen, for your insights as well. And for you, our viewer, of course, remember, regular screening is the way to go in terms of cancer management. Many thanks. Let's take a quick break. We'll be right back. But in that break, we have lined up a feature program in regards to cervical cancer, which is one of the leading killer disease in the country. 10 women every day. Take a look.
An estimated 5,236 women are diagnosed with cervical cancer each year in Kenya, according to data from the Kenya Demographic and Health Survey. The prevalence of cervical cancer screening and awareness was also found to be low, a matter that puts women like Monica Njeri at risk of cervical cancer.
Nilikuwa naisikia tu. Nilikuwa nasikia na watu wakisema wanaenda kupimwa. Na nilikuwa nasikia tu watu wakisema mwingine ako na kansa, lakini mimi kwangu sikudhani, sikuchukulia maanani. Sikufikiria mimi naweza nikaenda kupimwa, sababu mimi nilikuwa naona tu wale wako na hizo vitu ni wale watu wako na laana.
Cervical cancer is transmitted sexually through the human papillomavirus HPV. The first stages of cervical cancer is typically painless and takes around 10 years or more for cervical cancer to develop. That's why screening is so important.
Mara mingi hata nilikuwa nafikiri ati niko healthy. Sasa niko na hiyo miaka niko nao na ninapata period, mimi niko healthy. Lakini nilifika mahali niko na hapana, inakaa tena inaenda inakuja tena kuja kama siku 7. Niko na sasa hii bleeding imekuwa too much. Na pia odomen pia ilikuwa inaniuma tena sana na mgongo. Sasa hapo ndio nilifikiria niende nikapimwe.
The progression from HPV infection to fully blown cancer often takes 10 and 20 years in most cases. The time frame, however, can be shorter in individuals with weakened immune systems.
Nilifuatilia kwa mahospitali mingi sana. Lakini kila hospitali nikienda, mara wananiambia result hazijatokea, unapata miezi 3 zimefika result haijatokea. Mara mwingine anaona lakini anaogopa kukuambia. Anakuambia enda ununue dawa huko nje. Mwingine anaangalia akiona anaenda anaita daktari mwingine. Sasa ikafika mahali pia hata mimi kaza kuniogofya. Nikamwambia kama iko mnaniambia iko, lakini sikupata kuniambia hadi dakika ya mwisho. Nilikutana na daktari mmoja anaitwa Dr. Yeni. Yeye ndiye alikubali kuniambia. Na kwa wakati huo sikustuka saa hiyo. Lakini wakati nilikuja kwa nyumba nilikana nikajiuliza maswali mingi sana. Na nililia sana sababu nilikuwa naona ni kama nimefika mwisho. Hata nilikuwa nauliza Mungu why me? Lakini nilifika mahali nikajiuliza sasa kama sio mimi ni nani? Sasa ndio nikaanza kufuatilia matibabu.
Although she faced financial challenges in seeking treatment, early diagnosis prevents cervical cancer from spreading.
Mimi niligundua ikuwa kama stage 1. 2019 ndio nikaenda Mother and Child. Mother and Child sasa nikaenda nikaona ule daktari mkubwa, kuna ile siku gynecology alikuwa anapatikana. Ndio nikaenda naye akanituma Kenyatta. Kenyatta nikaenda nikapimwa kila kitu, nikatolewa kanyama. Wakasema nilikuwa wameandika agent. That means sasa kwa imeenda sana. Nikaandikwa agent na sasa hiyo nikaenda kwa daktari na nikaanza matibabu. Lakini kufika kwa daktari nilikuwa imefika 2B. Sasa mimi kwangu naweza nikasema hata kwenda mapema ilinisaidia.
Monica credits her family's support that gave her the strength to overcome. However, stigma and discrimination remains the hardest to deal with among those diagnosed with cervical cancer.
Kuna pande nilikuwa ninaishi. Unaona kama ni choo unaenda na watu wanajua wewe uko na kansa, hiyo choo hawezi ingia. Sasa unaona watu wanaenda wanaambia landlord, sisi kama huyu atakaa hapa itabidi sisi tuhame. Unaona? Sasa inabidi sasa wewe sababu wewe ndio mwepesi unafanya nini? Unahama. Kitu ya kwanza mimi nilijikubali na nikakubali ni kweli niko na saratani. Kwa hivyo ikifika ni mambo ya mtu, mimi nikiona unanibagua, mimi ndio ninakuondokea. Lakini baya ni baya, nitakuface. Nikwambia hii kitu hata mimi sikuzaliwa nayo. Nimekuja nikajipata. So the best thing hata uende kufanya nini? Uende ukapimwe. Na kwa hiyo hali watu wengi wameenda wakapimwa. Na hao watu walikuwa na kubagua, sasa ndio wanaanza kukutafuta.
Early detection, she says, is the key to ensuring no woman suffers the shame and suffering she experienced.
Mimi kwa saa hii vile nilijua mapema, kansa yangu haiko. Na siti yangu sabuilisha. Nimefanya mpaka pap smear. Nimefanya PET scan. PET scan pia imesema sina. Na kuambia hata kupatikana ati uko na saratani si ati ndio mwisho wa maisha. Maisha lazima itaendelea. Ujulikane mapema, utibiwe mapema. Na ukipatikana uko nao tutafute. Si tunakuwa Kariobangi, Symbol of Hope. Tuko pale, tunaweza kutembea pamoja. Kama hauna pia ni vizuri. Jaribu kuelezea mpaka wale watu wengine.